I chose to look into case number 8 in our book about dissociative identity disorder. The case is about a 35-year-old Caucasian woman who suffered physical and sexual abuse all throughout her life from multiple people in her life. Anywhere from her mother, her grandfather, her mother's boyfriends. Her mother also instructed the siblings to inflict abuse onto one another. So not only was Wendy receiving abuse, but she was also doing it to her siblings through the instructions of her mom. Some of the abuse that she had experienced is anywhere from sexual assault to physical assault, such as burning, cutting, and receiving unnecessary enemas, to the point where she would end up being hospitalized. Her body was no longer doing things it should do because of the abuse that she was suffering from. She's been hospitalized to inpatient psychiatric units multiple times. When she was hospitalized, she would receive many psychological drug treatments. Anywhere she would receive antidepressants, neuroleptics, beta blockers, seizure medications. She got lithium and anti-anxiety drugs while in receiving treatment. She received all these medications because her doctors misdiagnosed her when she was in. She was diagnosed with depression, substance use disorder, schizophrenia, and borderline personality disorder. None of which she ended up actually having. So she was receiving treatment for all of those, even though they were not occurring to her. She was later diagnosed with DID, which is dissociative identity disorder. DID is defined by our textbook, Durand 2019, as a disorder in which as many as 100 personalities or fragments of personalities coexist within one body and mind. It's formally known as multiple personality disorder. In Wendy's case, according to the DSM-5, she was diagnosed with dissociative identity disorder, post-traumatic stress disorder, major depressive disorder, recurrent episode severe, borderline personality disorder, and carpal tunnel syndrome, intestinal damage from laxative abuse. One of the articles I decided to look into for more about DID was called Dissociative Identity Disorder as a Wide Range of Defense Mechanisms in Children with a History of Early Childhood Trauma. In this article, it went into details about the specific types of abuse that are very common for people with DID, which does stem to sexual abuse, physical abuse, cutting, burning. Similar to Wendy's case, it was the same thing where they were getting it from not just one abuser, but multiple abusers. And the article went on to describe that most abuse for people with DID occurred before the age of 5. So they would experience all of this, and then the DID would stem from them trying to find comfort in something and dissociate from what was being done to them, sort of as a defense mechanism. In this article, it went on to describe 4 models that explain DID as an extreme way in which children try to cope with intolerable trauma from which they cannot escape. So the first model they discussed was the psychoanalytic model, which assumes that the alters develop due to being a defense mechanism to protect the individual. The second model is the auto-hypnotic model. It is similar to the psychoanalytic, but the auto-hypnotic suggests that they dissociate by engaging in auto-hypnosis, which then becomes a way to defend oneself against stressful situations in life. This model also explains why people with DID may not remember what happened when a different alter was experiencing the abuse, and then when another alter comes, they might not remember it. They may not remember it the same because their personalities differentiate between each other. It may even come down to there's this new item in their house and they don't even know where it came from because one of the other alters ended up grabbing it, buying it, so on and so forth. The third model is the developmental model, and it suggests that people with DID had a period of special sensitivity during which the traumatic events they experienced occurred and led to the formation of having multiple personalities. The time period that they are suggesting in this article that it happens is anywhere from the ages of 9 to 10 years old. Lastly, the final model that they discussed was the attachment model. This model derives from the object relations theory. If the parent or parents are the abuser to the child has to build powerful defensive reactions to maintain the attachment that is appropriate to having to their parent. For the critical thinking questions that were asked at the end of Wendy's discussion, number 1 says, there continues to be controversy over whether DID actually exists. Do you believe it is possible for some people to have several different personalities that may or may not be aware of each other? Why or why not? After reading the case of Wendy, I do believe that there is a possibility of having multiple personalities, especially when it does connect back to the past traumatic experiences, such as Wendy's, where they all took on, basically each alter had some correlation back to a piece of trauma that she experienced, and to help overcome or face what she could not do as her true self, being as that she was the one that experienced the trauma, so an alter would then want to experience or thrive off of that. I can see the other side of people struggling to believe that others may have multiple personalities, as it is a hard thing to prove that they are dissociating and someone else is running their body. The human brain is capable of many things, and I would not argue that it is incapable of also having different personalities for some. The second question is, DID has been used as a legal defense in murder trials. Do you think that DID can be a credible and viable defense in some legal cases? If someone, in fact, had DID at the time he or she committed a serious crime, should he or she be held accountable for those actions? Do you think it is possible for some defendants to convincingly fake the symptoms of DID? I do think that there can be faked personalities or people faking having multiple personalities. However, I feel that there is a way to truly tell if they cannot, because based off of some of the articles I've read, they can't differentiate from what one alter did versus the other. They don't remember it, or the pieces are not filling in properly. So my response was the second critical thinking question deals with the conviction of murder if the criminal is someone that has DID, and if it is right that they are convicted. I believe that if a person with DID commits a murder, that they are to be found guilty but should be placed in psychiatric care to help ease the threatening personality that in fact committed the murder. I feel that you can have them go into psychiatric care to maybe even interview more of the personalities. The second article I chose to look at, I actually decided to see if there was any criminal history of somebody with DID being convicted and how they may have gone about it. This article was called Who Done It Actually? Dissociative Identity Disorder for the Criminologist. The dissociation that occurs when abuse is happening serves as protection. Many people with DID have suffered from abuse from multiple people, not just the same person recurring. So it's just, again, stating that multiple people occur in these traumatic events. In the article, they mention that they can even have, their personalities have different ages. Sometimes they're not even human personalities. They can be animals or monsters. They went on to talk about how to go about interviewing somebody with DID, and they basically interviewed each personality. So they waited for each personality to make their appearance, asked them questions about what happened, and tried to piece it together in that frame. But again, as far as the question, yes, I do believe they should be convicted as guilty, because if you don't, then that person is still technically on the loose, because that personality is in that body. You never know what may come about from that person again. If they got away with it once, they might try it again. The third question is, what factors do you think account for finding that DID is much more common in females than males? My response to that was, I think the DID findings are higher in the female population than the male, because research has discussed that women experience traumatic events more than men, but I also question if this is completely accurate, because I can't help but wonder if some cases of DID are not being caught or diagnosed properly. Similar to Wendy's, she was misdiagnosed in the beginning. I think the findings are higher. Is that we are told men do not go out seeking help when they are having mental health problems. While they may have DID, they are not receiving help, therefore they are not added into the statistic, similar to what happened to Wendy. And the final question for critical thinking was, most cases of DID begin in the same fashion as cases of PTSD, exposure to extremely stressful or traumatic events such as sexual or physical abuse. What factors do you believe account for exposure to trauma manifesting as DID in some cases and PTSD in others? I said factors for exposure to trauma manifesting to PTSD versus DID are how you go about dealing with the traumatic events. For those with PTSD, they are living and experiencing the traumatic event all over again and almost watching it play out as if it were occurring right now and right in front of them. With DID, you are removing yourself from the experience and the event. You are dissociating away from it. You're not there, you're feeling it, but you're turning your brain off. You're not associating that you're actually there. You put yourself into a hypnosis state of mind. I think the biggest factor of having DID versus PTSD is how the person deals with the traumatic events that are reoccurring. For Wendy, she began to dissociate from the events and in turn create these separate personalities that then overcame the fear that she had developed from the trauma that she experienced. And lastly, what I found very enjoyable was digging more into the criminal aspect of DID and seeing if there are any cases out there like that. I'm still blown away by how many personalities can be in someone's brain and taking over someone's body. The fact that it could be completely different ages, even from that of the person experiencing it and having DID. One thing I would be more curious about is to look into children with DID and when it may start to come about. Like if they're experiencing this trauma at 5, could they start showing symptoms of DID when they are 6?